Delegate Miller is offline yet. Delegate Miller, and no, we're not offline. All right.
You're live right now.
All
sir.
right. So I got jumped there. This is a meeting of the Education Subcommittee of Ways and Means on March 9th. We will be taking up 4 bills today, 2 of them local and 2 of them statewide. We will start from the top down on the bills. There is one bill that was added to the agenda. It is a local bill with a local letter, so I don't think we'll have a great deal of trouble with it, but certainly we'll entertain comments. But we're going to start at the top, working backwards. House Bill 878, Public Schools Student Telehealth Appointments, Policy and Access. I will let council drill down this a little bit, but basically, in essence, this bill says that if a student needs to access telehealth during the school day, because that's what appointments are often available, the school needs to create a space for them where they can do it privately, and a space where they can actually access the telehealth they need. Lots of doctors only available during the day, and so the school has to create a space. There's some requirements in the bill about the nature of the space in this case, and we also have some amendments to the bill, and I'm going to let Alistair tell us if there's anything I missed essentially about the bill, and also then describe the amendments to us.
Nope, you got it. It requires that each county has a policy for telehealth. The amendments ensure, so as the bill came in, the policy has to provide a private space that is a space that is private, that has internet access, that is not a bathroom or closet, and that includes at least one seating option and a place to put a flat laptop-like device. One amendment adds to that it be observable from the outside to ensure the student's safety. And then as it came in, the bill required that that school personnel were trained on the model policy. Rather than that, the amendment makes clear that they just need to be made aware that there is a student telehealth policy.
Okay, are there any questions on the bill or the amendments at this point, since we have the amendments, but there's no motion on them yet? Okay, I don't see it. Oh, yes, Delegate Miller. Oh, we do have some. Excellent.
Sorry about that. Okay, I don't know. I wasn't here for all the amendments or whatever that we went over, but my main concern with this is how are we dealing with parental notification and payment for a telehealth appointment? Are these only ones that are set up by parents, or are they also set up by students who are able to consent as adults?
There's nothing in the bill about that, so I would assume they would be set up in the exact same manner that a student would if they were dismissed from school and allowed to go out and drive. The parent wrote them a dismissal note, they got out of school, and or at the end of the school day if they left and did a telehealth appointment. So there's no parameters placed on that in this bill.
Okay, can we maybe I can meet offline as far as figuring out the impact, because a lot of my questions about this was about practical things as far as insurance and payments, and if students because students in Maryland are as 12 able to consent as adults. So if a student does set up their own, logistically, how does that work? And as far as HIPAA and FERPA, so I had some questions and concerns if this is moving forward of how that would work, but I'm pretty specific on those issues. So if there's a suggestion of someone I could talk to about that there are definitely some concerns and some privacy concerns, and some, if we are allowing counseling, because if there's a safety way. So when you're doing either therapy or you're doing a telehealth appointment with a minor and someone else is in the room, like as far as a parent or the parent knows that the child is doing this, versus in a school system where the child may be alone with a therapist that's on the telehealth visit, and that student has some kind of issue or crisis or something along that, how is the therapist going to notify the school if something troubling like that is going on? So there's just some practicalities from a healthcare standpoint that I have with it.
Thanks for voicing those concerns. Are there any experts online who would like to address the questions that Delegate Miller has put up here? All right. There's no one who my general answer would be is that this would adhere to the same sort of rules for payment and for access that any doctor would allow if they were a doctor who was expecting to bill someone. I don't, I can't go to a random doctor on telehealth and say, I don't really have insurance, but I just want to talk to you. And so I don't think they will. So I don't believe this creates a unique situation, but that would be my general answer to it. Let's go to Delegate Vogel.
Yes, Alistair, you mentioned that one of the amendments required that these rooms be observable. What does that look like in practice?
Well, that's a good question. We could ask. The way I see it is, we didn't want to put this in here because if we say it has to be a glass window, then suddenly we create a new structural problem, and it could be. But the idea is that if the student finds out something, if their telehealth tells them they have cancer and they break down or they pass out, we need somebody to be able to administer to them and know that things have gone awry for them in this visit. Normally, if your doctor tells you that in a non-telehealth situation, they're there and they can administer to you in that situation. So we just thought that it was important. Well, at least we considered that it was important for them to have somebody with eyes on them. That's all. We outside, I think, implies that they can't hear what's going on, or shouldn't be reading the lips or looking at the screen or anything like that. I think outside just meant that they could see that things were generally in order. And I believe that's what we went for. If we feel like the amendment does that, we can stick with it. Does anybody else? We got some experts here. I see people from MABE and PZAM. We got Maddie from Strong Schools. We have Dwan Stair from the city schools. So if any of you want to weigh in on that concept, I'm happy to listen. Okay.
Mr. Willems has his hand raised.
Got him now. John Willems, who is from the Maryland Association of Boards of Education. We've seen him testify in front of our committee several times.
Chair Ebersol, thank you. Yes, so we are certainly concerned with the facilities, requirements. We've encountered this in the context of seclusion rooms, which over the course of 20 years became very controversial and now are essentially prohibited, but access and visibility into those rooms was a key component of the reform at one point, to make sure that students weren't isolated in rooms that we couldn't observe continuously. And I would just add that a major issue for us, I think, with regard to this bill is there's no reference to state school health service guidelines. So it refers to local telehealth policies. But generally, we would prefer to operate in the context of something developed by Maryland Department of Health and MSDE's School Health Division to bring experts together, develop guidance for everyone to model their local policies on.
Let me add a question. How would you draw a comparison between what we're talking about here and, for example, the Title IX requirement that we require breastfeeding locales for students? And obviously, no one's going to observe those, but they don't also rise to the same possible stress level. But do you see any parallels between those?
I do, in the context of providing the space and the access of the student to service in the school setting in kind of the least disruptive, least time out of school manner. But it is the content of the telehealth session, whether it's somatic, whether it's physical health or mental health, and I would say whether it's in accordance with a plan. So the pregnant and parenting students we've identified, and we have to have plans for them, and we have to make sure that they have access to services as pregnant and parenting students. We don't have any connection with regard to a student health plan, which would typically be triangulated between the doctor, the school nurse, and the parent. And so that plan becomes the basis of school-based health services. So there's also no reference in this bill to essentially a requirement that telehealth be included in a student's student health plan, so that the school nurse has some baseline on which to understand what's going on in the telehealth session.
So are you suggesting that a student wouldn't be able to access this unless they had a telehealth plan? Is that right?
No, because I think telehealth could certainly be of use in more ad hoc situations where the parent notifies the school that they're essentially unable to accommodate the health visit other than in this telehealth situation. And can the school allow the child to, work with their healthcare provider, again, either mental health or pediatrician through telehealth, but some type of notification and permission from the parent would certainly be important.
Okay, thank you. Delegate Wu.
Thank you, Mr. Chair. I think I have two questions, maybe concerns as well. So first one, we know in the school system, we have a nursing shortage, right? We have a staffing shortage. How do we expect the school to manage the situation? In general, I support the idea of telehealth, but in reality, how do we manage that? I think if we have anybody from the school system say, are they going to, do they need extra people, or the student on a free round, they can do themselves, right? That's my concern.
Well, I think you're starting off with school nurse. I don't believe anything in the bill requires a school nurse to be the person who facilitates this.
Yeah,
So
so
we-
my question is, who is managing the program, right?
Well, the bill calls for the school system to have a policy. And that was what I wanted to tell Mr. Williams also, is that the policy will exist and it can vary how they access and who they think should access, who should be the person.
So it's not mandatory, right? It's
that?
optional. It's not mandatory, it's optional, right, for the school.
It is mandatory that
It
they
is
would have a
mandatory.
policy
They'd
under the bill.
They'd have to have a policy and they'd have to provide a space. Those are the two things.
I think I have a policy, I can agree, but in terms of mandatory, I think a lot of school systems probably don't have space or personnel to manage it. That's my concern, right?
Okay. Well, thank
My
you.
second concern is about the risk, right? If we said we want a privacy in terms of student do a telehealth consultation, what happens if there is a crisis or some student commit suicide during the consultation? Who will take the risk?
So, Alistair, do you think that the school be more exposed if a student, because they were in telehealth when a personal disaster occurred, as opposed to another time?
I think that what the bill sponsor testified to and had people testify to when she brought this bill before the committee was that currently people are accessing telehealth in the midst of other students in their cars in a non-private setting, and that's leading to they're being exposed and not having any sorts of protections, and that was the thing that she was trying to solve.
Okay. Delegate, is that good?
No. So my question is, does the school have extra liability here? Do we have codes to protect the school system? Because we are providing service here, extra service, right? But if something goes bad, who is taking the risk?
So that's the question I ask again. Do you think the fact that it would be associated somehow with telehealth would expose the school to greater liability?
I don't think so. I don't think that having a policy would stand as some sort of endorsement of anything that happened in the telehealth session. Yeah, that's my best answer off the top
Good
of my
question.
head.
It's something we need to think about. I'm going to turn to Dewana Starrett from the city because some people have been asking questions about logistics and things like that. So maybe she'd like to weigh in with us.
Yes.
Okay,
Good morning. Good afternoon, I should say. For the city schools, I wanted to piggyback on what Mr. Williams mentioned. One about the space. We would have some space challenges in several of our school systems. Even finding lactation rooms in some of our high schools has been difficult. Having a private, confidential area. I understand what Alistair explained about possibly not having greater liability, but I think there is a possibility of greater liability because when you have a person escorting someone to a confidential, potentially quiet place, and then you, through HIPAA, you cannot sit in and listen, and something could happen during that time. And so I think it does expose the school system to greater liability.
Okay, that's why we did observable, but it may not cover it. Thank you. That's helpful. I'm going to come back to Delegate Miller.
Thank you. I really appreciate that. Is there anyone on the call that is an expert in HIPAA? Because when you're bringing a telehealth appointment into the schools, it's beyond a school policy. You are talking HIPAA regulations and you're talking practitioner healthcare, and how that operates is different than in the schools. And again, I understand the intent and I understand that it would be helpful to make it easier, but I think we need to look at this from a practitioner standpoint. So either from the medical community, from someone from, as far as HES, we need
So
some
the answer
kind of
to your
different
question is there is
perspective.
no one online who can help us with that, right?
I don't think that's correct, that it makes a school a covered entity under the definition of HIPAA. That really
Yeah.
only applies to healthcare practitioners and those.
But this
offering
is
health.
this is a healthcare practitioner who's
No,
practicing.
the
in
person on the
school.
other line of the telehealth call is a healthcare practitioner, and the school is not a healthcare practitioner.
I understand that, but my point is that practitioner is practicing that. So what would their aspect as far as having a student and doing an appointment in a setting like that, in the school like that? So I understand the school system setting up a policy, but I'm also talking, there's a HIPAA perspective that we are looking at from the healthcare perspective. And I think we need to have that perspective as we have this conversation.
Was any of that in the testimony, Alistair? Did anybody ask these questions during testimony?
I don't believe the members did. I do think we got some testimony from doctors and healthcare providers that was in favor of the bill. Fortunately, I have not read it recently, so
I didn't recall anything either. So it's coming up now. We could have actually had some people online if we didn't know those were the concerns. Duana, I see your hand up again. Have you left it up, or you do want to say something else?
Well,
I'm sorry, I
did
forgot to lower it. I'm sorry.
Sorry,
No, I
and
wasn't
I did
talking-
bring this up.
Okay, thanks. All right. I like to let experts get in here with us in between a little bit. And Mary Pat Fannin is from what is colloquially known as PAZAM. It makes me laugh every time I say it. Maryland Superintendent's Organization.
Yes, thanks. This may muddy the waters a little bit, but I was doing some research on Delegate Miller's bill, actually, the age of consent. And so this may help, but if you have a qualified, certified professional employed by the school system, I was asking about consent. And in that situation, you have to have consent from to the age of 18. But if there are licensed professionals that are working in your buildings, contractors, HHA personnel, et cetera, the age of consent for mental health is 12. And that's, to protect to see if there's any, any risk with the family. So again, that's behavioral health. I don't know about somatic health, and it may be worth just touching base on mental health versus behavioral health and consent. So,
Okay, thank you.
Mhm.
All right, Delegate Ferry, thanks for your patience.
No, thank you. It's a very interesting conversation. I just had a few comments. I was tracking the HIPAA compliance conversation very closely. The HIPAA compliance is, Alistair, am I correct with what you said? The HIPAA compliance portion falls on the practitioner, not necessarily. For example, if I'm in telehealth in my own home or out in the middle of the street, there is no requirement that falls on anybody else except for where I'm at. And the only person who's required to follow HIPAA compliance is the practitioner on the other end of the line with me. Is that correct?
yes, as I believe so. I'm not an expert in HIPAA, but I believe that the covered entities are the healthcare practitioners, and obviously your own healthcare information, you have the right to waive.
Thank you.
And
my general, I did understand a lot of the questions were around insurance, the use of insurance for paying for policies and things like that. All of these telehealth appointments would work through the student's standard. If the student has insurance and is electing to use their insurance, it would go through the standard insurance process that any other telehealth appointment would be treated as. Is that a fair assessment, Alistair?
yes, again, not a great health expert, but I do know that recently Maryland has passed, in the last 2 years since the pandemic, or last 3 years, sorry, several statutes on telehealth, and the broad scope of them is that it has to be treated in the same manner as other healthcare. And
By the way, Delegate Fair, you're allowed to offer if you have expertise. In other words, we can ask, but we also bring our expertise to the legislature. So if we have, some expertise that's credible, it's okay for you to tell us what your experience is or what you think would be the case.
Yeah, and that's where, thank you for that, Mr. Chair. I appreciate the latitude to be able to share a little bit of the experience that I've had in this specific field. My larger concern to Ms. Durrett's earlier point was that we have students who are seeking out mental health care treatment for potential crises. The concerns about the individual either acting on suicidal ideation or acting out on physical harm during a telehealth appointment is contrary to the logic of the individual receiving the telehealth, and rather in the inverse of that discussion, it is more likely that the individual who is not seeking actual mental health care, who is not seeking assistance through these telehealth appointments, is more likely to commit an act of self-harm or suicide or suicidal attempts, and that it can include in the school system itself. I would maintain that that is a grave concern for liability to the school for recognizing students' mental health needs, and we should be looking at providing reasonable accommodations. Nothing, as I mentioned, I believe in the hearing on this, precludes a youth from stepping out of the school after hours, walking right around the corner, picking up a phone and calling a telehealth specialist. This guarantees that the youth is at least in a safe, confined space that they are able to access their basic mental health care needs. And so I would encourage the folks reviewing this bill, please, I'm happy to chat more offline about this, about the issues around this issue and the challenges and unintended consequences when we do not, when we're providing them with no resources and instead just sending young people out into the world.
Thank you for that. Delegate Vogel, I saw your hand up before and then it went down and now it's back up. I'm assuming you now actually do it. You're a tech wizard and you want to talk now.
I just love putting my hands up and down, you know.
That's cool.
No, so first, and I think Delegate Fair made this point. If you're in a telehealth appointment here in the House of Delegates, which I've had to do before with, you know, for One Medical, I have the app where I can just see a doctor on my phone. The General Assembly is not liable for my appointment, correct?
I think that's fair to say.
Okay, and you know, a follow up on the privacy point, I understand the argument being made here, and the concern is valid around the safety of students who are participating in these appointments. But my understanding is that psychologists or any mental health provider who's providing via telehealth is obligated in certain extreme situations to be a mandatory reporter and either notify law enforcement or notify someone else who can intervene if there is suspicion of harm to oneself or to someone else. Is that correct?
That is correct, and that is an exemption to the HIPAA privacy rule.
That's an exemption. So that is already in place. So if there is an extreme situation, if a student while on a telehealth call expresses that they are seeking to harm themselves or harm someone else, the mental health professional is obligated to report, right? To circumvent HIPAA and make that report. Okay.
Yes, sir.
Yeah, we are educators too. So if there's any indication, although we wouldn't be listening in if a student came out and said, you know, I'm going to kill myself. We were told never, even if somebody joked about it, we were to report it. Didn't matter. So Delegate Miller and then Delegate Wu. And then I think we're going to see what kind of action we're going to take after that.
To Delegate Fair's point about insurance. So again, if the student is setting up this appointment, the school system will have, even if it's a school-based health center or clinic, the school system will have nothing to do with that, because usually with insurance, a parent will receive an EOB if they are using their parents' insurance.
I think that I'm sorry, go ahead.
Go ahead, Alistair.
No.
I was going to say, I think in the case of a school-based health center, that's not true. That is a HIPAA covered entity. That is, they will be involved with insurance and so forth. I think in the case that I was contemplating with this bill, it's you're contacting your private your personal doctor who is not associated with the school or the school-based health center or a school nurse or anything like that. But yes, you were correct that if you were attending a school-based health center, I think that will involve all the medical requirements and things and bring the school and the local health departments on board.
Okay, so even if they're using Medicaid, the parent, even if they're billing Medicaid at the school-based health center,
but we're not discussing school-based health centers here. Let's stick on.
I know, but
we're on telehealth here, so
right.
I would like us to stay on point here a little bit. We're not school-based health centers is a different entity here.
I'm trying to figure out the insurance piece with the telehealth. So this is, the school would have no access to, with the telehealth visit, the school would have no access to the child's insurance information. that would only be directly given through the practitioner and through the student.
I believe
I
that's
correct
true
in that?
any more than in the scenario that Delegate Fair described about a student walking across the street after school, off school grounds. The school would, there'd be no involvement there either. That'd be up to the practitioner to know what their involvement is and what their billing is.
All right, then I understand.
Okay, Delegate Wu.
So, Mr. Johnson, I have a question in terms of the liability part, right? So there's a difference between school playground and the school building, right? In terms of liability, right? So if we set up environment, we ask the student to do something, I think we are ensured they're safe there, right? I think in order to protect the privacy there, so we're not able to monitor that. And at the same time, we assume everything will be good. I have a huge concern because medical consultation can be sometimes unpredictable, right? So I don't think we are ready to handle that situation at this moment. We need more study on this. So personally, I think it's a great idea, but it makes it right. It's not easy.
All right.
Yes, there's a legal torts concept called attractive nuisance that if you have like a playground or something that might attract kids, you're liable for their coming on board. I'm not a great torts lawyer at all, so there may be other concepts that are at play here, but I don't know if that is totally applicable in this case. But yes, there are circumstances do dictate liability, and potentially there could be some increased liability in some manner.
All right, so we're kind of at a nexus. We have some people, some concerns. We could answer them. They may not be in our opinion ones that really apply. And so what I'm going to do here is I would be willing to continue with this bill at this time, but that doesn't mean that the rest of us have to be. So I'm going to take a straw vote. Well, I'm going to let Delegate Fair go first before I say it. We're going to take a straw vote to see if we should just hold this bill till the next meeting, which will come sooner than before because we're getting close to crossover. We'll probably meet pretty quickly for consideration. But then I would like us to come back with some clear opinions and some clear actions. If we vote not to do that, then we will move forward on looking at the amendments, see if there's any other amendments we want to add, and then move on, and then see if we want to move on the bill. So, but first I'll let Delegate Fair go.
Oh, no, I was going to ask for a clarification on the amendment. So please
Okay.
go back to what
So
you were doing.
let's take a straw vote. We have 1, 2, 3, 4, 5, 6, 7 people present. So 4 will carry this. I need to know, I'm going to put it up. As I said, it's not a motion necessarily. It could be, we can make it official. We're ad hoc. I would like to see if we can decide if we'd like to hold the bill till the next meeting with some investigation or prepared to move forward. So I'm going to say those in favor of holding the bill and not voting and not moving on it today, raise your hands, please. 1, 2. Okay, we've got plenty of people. So we're going to put this aside for today. I want some meaningful conversations with, you can go and find Alistair and chat with him about possible amendments, or talk with me, or talk amongst yourselves, or talk with experts. I want to come back with opinions. It's my opinion, this is overall a very important idea, and we need to find a way to manage it. Delegate, we'll make it quick for the good of the order on
Sure.
this.
So Chair, so if we have a question, who should reach out?
Well, Alistair will be your first point of contact.
Okay.
He has an office in Ways and Means. Don't overburden him. He's got a lot to do, but if you want to bounce an idea off of him, that's fine. You may also ask some of the experts you see here, John Willems from MABE, or I see Alexis still here from PZAM, but also Mary Pat Fannin, if you want them to tell you from their point. Also, is Dewana, Dewana also. We got lots of experts here to gather information from so that we can move forward and talk about it some more. All right, so we're going to put that one aside. And the next bill we're going to consider, a bill with a bit of a sponsor problem, but I think it's a good bill. House Bill 576, which is entitled Primary and Secondary Education Policies on Bullying, Harassment, Intimidations. And there's some revisions to the laws that exist. And the basic revisions are this. When someone is bullied in one of the protected classes, and they are listed in law right now, there's a list of them, we can read them if you want us to. There is usually a report made, but there's no requirement that a report's made. Circumstances are is that a student could say, no, I'm fine, and that's the end of it. But really, if it's the judgment of anyone that it was motivated by this person's membership in one of these protected classes, that this bill will say a report must be made. If the student chooses not to, then a qualified staff member the administration will pick a qualified staff member to make the report. Once the report is made, then that's good for data going forward to MSDE, but also then it rises to a level where people need to be notified. And the reason this bill came originally was because parents were having their kids be bullied. I can give examples, there's lots of them. But the student would come home and no report was made and no one let the parents know. And that student went to bed and went back to school the next day into the same circumstance without any care at home. And so this bill requires that within 12 hours of the report being made, which would make it before they went to bed essentially, that the parent, or at least by breakfast the next morning, the parents would know. So those are the two major pushes of the bill. A report is going to be required in those circumstances by someone, and that the parents or the guardians or whoever's watching after that child at home be notified that there is a report and tell them about the event. Alistair, anything else? Any other details I missed here?
There in the current law or in the bill as it
In the bill.
before? There's also a requirement specifically about in reporting if a student belongs to a certain group or is perceived to belong to a certain group, and that seems to be the reason they were bullied, then that those groups are bullied on the basis of sex, sexual orientation, or gender identity. If that is the case, then the parents will only be notified at the discretion of the
Report is still made.
report. Yes.
The student can decline to have the report called home. And that became a pretty big, if you remember the testimony, that became a focus of the testimony. There was a fair amount of support from the LGBTQ community on that. Also, Alistair, while we're on it, we have one amendment that we would like to offer. So let's describe the amendment so people at least know what we're thinking about.
Yes. So thank you, Mr. Chair. Under the current law, there is a civil liability exemption for reporting bullying. As long as you follow the model policy and report bullying, you are exempt from civil liability. The bill did not extend that to not reporting to the parents on the basis of this decision by the alleged victim to not have it reported home. So that is clarified to say, if you follow the model policy, including not reporting it home in the case of a alleged
Right.
sexual
Because them in
orientation.
their testimony said they were concerned about that. And we're willing to say that, they're making their best effort and we're not going to make them civilly liable if it doesn't fall out the way they wanted to in this case, especially in the example where a student denies, but then the parents are upset they didn't find out. We weren't going to hold them civilly liable. So I hope we're answering. Alexa, I'll ask you quickly if that amendment seems to answer that concern or not to you. And maybe she's there, maybe she's not. Okay, we'll try coming back to her in a second. Delegate Wu.
Sure, I think definitely I support this kind of effort. I have a question. Why race is not included in that
I think
list
it is.
factor? No, I don't think it is.
By race is included in the definition of bullying. So it's not included in the definition of this specific exemption from notifying the student's parent or guardian.
But
So
bullying does have race in it as one of the ones that's considered bullying because of that protected class.
Would you
I
like me
think
to read
sex
the?
and sex and others are protected class as well. Is that right? No.
Sorry?
Yes.
Yes,
Sex are
okay.
protected.
You
because-
understood the question. That's good.
So
Would you
my
like me-
question, like we add sex there, but I don't see race and other stuff. It's adding there, right?
It's not in the bill. It's in current statute. I can
In a
read.
different section of the statute. So it wasn't included by the drafter in the bill, but Alistair, can you quote the education
Yes.
yes. article?
So the definition of bullying, harassment, or intimidation means intentional conduct, including verbal, physical, or written conduct, or intentional electronic communication that creates a hostile environment or substantially interferes with the student's educational benefits, opportunities, or performance, or with the student's physical or psychological well-being, and is motivated by an actual or perceived personal characteristic, including race, national origin, marital status, sex, sexual orientation, gender identity, religion, ancestry, physical attributes, socioeconomic status, familial status, or physical or mental ability or disability.
And can you tell what article that is in case somebody wants to go read it?
Yes, it is section 7424 A21 is what I read.
Okay, thank you. So
of
the
the
language,
education article.
so the
Of the
spoken
education.
language is not added there too, right?
Say that again?
Like the language the student spoke is not added there, right?
Well, yeah, because it could be motivated if they did that.
But I mean, it's not included, right?
The language the student uses.
Yeah,
The
no, the language the student spoke, right?
Oh, I
speak,
see. Their spoken language.
Right.
No, that's not included. It has not been in the law. That would be an interesting bill for the future. It's not it. We're basing this on current law, obviously. So we didn't seek to change the definition of bullying in this law.
I see. Okay.
Good idea, though. I like it.
I think that's important. It's very.
Okay, I don't think we'll do it.
multi-language.
I don't think we'll do it here, but it would be something to take on in the future about the protected classes. It'd be interesting.
There is
No.
national origin, but not language.
Yeah,
spoken.
national origin, right, but not language spoken. Delegate Miller.
So does the report trigger an investigation? I understand notifying the parents, which I think is critical, but then also does it trigger their normal investigation process for what happens when you file a bullying report?
By whom?
The school system.
Well, the administration does deal with this as discipline. I mean, this is a bullying. They create a report. They follow whatever disciplinary policy the school has on it, I would say.
Well, it usually is followed by an investigation, which is one of the reasons why a lot of students don't like to follow the bullying report, because then it tends to make them targets or targets from other individuals' friends. So that's my concern about this is when you do file a report and it does elevate it to another level, there is a process that has to be followed by the school system.
Did you say it usually triggers an investigation or by law it triggers an investigation?
By law, it will trigger an investigation.
Do we have a law on that to that effect, Alistair?
It's either a law or a
I've
school
asked him a
system
question.
act.
Hold on, let him answer the question. Do we have a law to that effect that says if there's a case of bullying that it triggers an investigation?
I'm not sure if that exact term is used in
Yes.
the law. I think someone online might be able to answer it a little bit better.
Okay.
I do
Let's
think
see.
that
Who we got? Maybe John. John Williams, do you want to answer that or not? Can you? No, people are online. There he is.
Yeah, I don't know that it specifically off the top of my head that an investigation is required. But to Delegate Miller's point, it is one of the reasons that there is some interest and popularity for anonymous texting of bullying reports to avoid the retribution against snitches, if you will. And so it is something that school systems have the service they've contracted for and employed from time to time to allow for that anonymous reporting of bullying incidents. So yes, but typically there would be, the assistant principal would contact the parents, but it's all based on local practice, is my understanding, whether there's a mediation, whether there's a meeting requested between the parents of the victim and the perpetrator or not. It's all case by case.
All good things that I think should happen. Delegate Fair. I'm sorry, Alistair, did you have something to throw in there?
yes, I was just going to say there is an oblique reference to it. There's no specifics on what an investigation must entail, but in the report that like these reports trigger reports to the county board, and those have to be reported to MSDE. And in that report to MSDE, they have to talk about the results of the investigation. So
Okay.
there has to be some sort of investigation. It's not in statute what that has to entail. I don't know what the regulations might specify more. It might be up to each county board. But I can look into that if you would
Okay.
like, Delegate.
Delegate Fair, that good? Oh, that wasn't you. Delegate Fair, you're up, actually. Sorry. I'm
Delegate
moving
Miller.
fast.
Yeah. Yeah, and I appreciate all the thoughts so far shared. I just wanted to touch briefly on the impetus behind the bill and a few important points. First, we have the issue around notification of the parent. I appreciate the bill sponsors' intention behind this bill, because it actually helps bring our state into alignment with many of our county boards of education who currently have protections in place to protect people based on their sexual orientation and gender identity. And the current bullying process actually is a end run around those current protections. And I don't need to look any further than my own personal high school, Linganore High School, to see how that end run works. We had a report at our local nonprofit in Frederick of two kids being bullied at that school who were being called the F word. That is a derogatory term for gay and lesbian individuals. They were being called the F word in the school system by the students, by other students. They, of course, fought back. There was an incident reported. They did not clear it with the kids to contact the parents ahead of time. The school system, in turn, outed the students to the parents who had no idea of the children's sexual orientation, and created the exact nightmare that this bill seeks to resolve, which is bringing the issue first to the student and allowing them to self-determine if they would like that issue brought forward to their parents or not, seeking not out of any harm towards the parent at all in that specific scenario. Thankfully, the parents were very affirming and supportive. However, it is not always that case. Actually, I take that back. One set of parents was affirming, the other set of parents wasn't. The student who lives at the house with the parents who weren't affirming is now living at the house with the student whose parents is affirming. Right. Because of the nightmare that was created from that situation. So I really appreciate the sponsor's intention with this bill, and I encourage the committee to support this initiative.
Yeah, and I think I would add that it would liberate students to allow the report to go forth at school, which they might not be willing to do otherwise. Delegate Hornberger.
Thank you, Mr. Chair. So I just want to parse this out a little bit more here. Students sometimes are bullied for multiple reasons. In the specific case here where we're allowing the child to have the option of whether or not it gets reported to the parent because of sexual identity or history or what have you, the child is still being bullied. So can the school notify the parents and omit the part about the sexual orientation?
I would think so, actually, but that would be something they would consult with the student about, considering, and somebody brought a case to me where they said a student was beaten and taken to the hospital. Can't you report? Right. Of course, that rises to a whole different level. A school is going to make a report if the student was injured as to why they might be discreet based on the student's wishes if they were conscious in that case, but generally. Okay,
so in the case where it's, let's just say it's purely based on sexual orientation,
right.
The child's being bullied, the parent's still going to be notified. That's a shall, that the child is being bullied. However, the rationale for the bullying will be omitted if the child so chooses.
Alistair, take that up.
Yeah, under the bill as it's written, if a child is being bullied solely because of their sex, sexual orientation, or gender identity, it'll be at the discretion of the child whether the parent should be told or not about that incident.
So the answer is probably not the one you want to hear, but they might not find.
Yeah, so that's a little concerning to me. Is there a way to, cut this in half to where, because I think the parents should still be notified that the child's either being hurt, whether it's online bullying, etc. But I do want to respect the child's wishes to maybe not disclose the reasoning for it.
And I want to be clear, there is a reporting process already in place by MSDE on this, like when these issues happen and when they're determined to be motivated by the students being in a protected class, a report is supposed to be made. And so
yeah, but not to the parent.
Right. There's nothing, what the original law says, the parents that they had to notify the parents within 3 days.
Right.
And so there was already some notification, but the carve out wasn't there.
Yeah, I like all the parts about the bill. So let's just do a anecdotal here. So my student gets beat up badly at school. It's found out that the reason that my son or daughter was beat up was because of her sexual identity. The child opts not to have the parent notified. So now the child comes home and the parent is blocked from knowing what happened with the physical fight.
I would say they wouldn't tell them about the report. My guess is if a parent came in and talked to the administration, and ask, in other words, it's not like it just says that they don't have to have the report shared. It doesn't say that this information has to be kept secret necessarily.
Okay.
Is it?
All right. Thank you.
Is that accurate, Alistair? Am I?
Yeah,
I gotta
yeah,
be
you're
careful.
right.
This is my bill, so I gotta be careful that I don't get, a little, that I don't say things that actually.
So it's not necessarily shielded.
I don't think, no, there's nothing saying.
No,
They can
it's
just-
about, sorry, go ahead.
Go ahead. You got it, Alistair. You got it.
It's about the model policy and what reporting steps are triggered by that model policy.
All
So
right.
under the current law, the model policy is you report it to the parents. And this is saying in this specific instance, you check with the victim and the victim then determines.
Okay, thanks.
Delegate Vogel.
First a point, and then I have two quick questions, Mr. Chair. Thank you. First of all,
entertain them all.
and just to follow up on some of the other questions that have been asked and raised, I wish in an ideal world, right, there wouldn't be an issue with parental notification here. The impetus for this bill is that for many students who might be bullied for their sexual orientation or gender identity, it actually gets worse if the parents are notified, right? Rather than the parents actually be welcoming and supportive, the trauma that they're facing could actually escalate, as my colleague Delegate Fair presented us with an example of. A couple of questions. First of all, and I'm sorry if this is already in here, but under the existing reporting procedures, are school mental health professionals notified at all if there is an instance of bullying?
My guess, I see Alistair studying, my guess would be yes, that the whole reporting process is designed to at least trigger some actions. I should point out the reporting is also for gathering data. I mean, MSDE makes a report on how many instances of bullying there are, and they break it down by school systems. So partly it's for information, but it's also partly for the student. I would assume yes. The report doesn't automatically define the reaction of the administration. Administrations do what they need to do to take care of kids and to punish kids or to discipline them or to help them. This just says that anyway, I'm going on. So I don't know, Alistair, do you want to answer that? I'm rambling a bit here.
I think you're totally right that this, in general, this policy is more about keeping the school systems, the State Department of Education, and the General Assembly informed about what's going on in the schools, whether these incidents have what kinds of incidents have happened, and that sort of thing. It's not the policy is not necessarily going greatly in depth about how to respond to it at the state level. That's probably a thing that the local school systems are doing, or the principals themselves. I don't know.
I'm sorry.
I don't think there's anything in statute requiring that school counselors or other mental health professionals have to be informed, but I do think that's probably what the policies of the county boards and the schools would.
So there's still a policy that the school systems have on all this, and this is not impacting that policy, whatever their policy is in this case. I will say, let's remember too, that this is not just about LGBTQ students.
Yep.
This was motivated by a Muslim family who came to me and said their kid was being bullied, and they didn't find out. Okay. He or she, I forget which, was coming home and living with it and waking up the next day and going back in, and there was no report being made because the kid wasn't making a report. People would say, "Are you okay?" And she would say, "No, I'm fine. It's okay." And then nobody would make a report. So the original purpose was to say, got to make a report. And then the report triggers making sure that people at home know and can help them cope with what's happening to them. And then, of course, we came across the very issue you've described, that there, and you and Delegate Fair have both described poignantly, that that the business of LGBTQ is sometimes more clandestine with students at that age, and may trigger problems in the household. So
Yeah. And
we didn't have that in the bill originally. That was brought to us by the community. Hey, you can't just do this. And so we put it in at the request of the LGBTQ community.
And I love this bill. We've talked about it quite a bit. And I also appreciate the fact that it does reduce the amount of time that the parental notification time from 3 days to 12 hours, which, as you mentioned, is going to be really helpful.
We pushed back on that. They said it would be tough, but we're going to stick and see if it works. I mean, we meet every year, so we'll see what happens. But I think if it happens at 2 p.m, then sometime before they go to bed, or at least by the next morning, somebody should know at home that something has happened.
On my last, just I'll be
right. You had another one.
Sorry. Just on a point on my last question. I think especially in cases where parents can't be notified, I think, and I'll take a look. This doesn't have to be the subject of this bill, but I'd be interested to see what the policies are in our counties, that the student, especially the LGBTQ students who don't have that support at home, should have some mental health professional in school or some trusting adult they can go to get that support, especially if they can't get it at home. My second question on the bill. So it says, if an act of bullying, harassment, or intimidation is determined to be motivated by the alleged victim's actual or perceived sex, sexual orientation, how are we determining if this is being motivated by their sexual orientation or gender identity? My concern here is that we could actually be outing students in the process of determining that. So curious as to what
that could happen right now. Okay. Mm-hmm. In other words, this is not something this bill addresses. I understand your concern. Somebody has to, make a guess. And I see Alistair trying to take me off the legal podium and get on it himself. Go ahead.
Please throw your tomatoes my way. So if someone is just called a name or something, that's not necessarily going to rise to the level of bullying as it's specifically defined here. This is really about like very heightened standard of, threats that are like actually threatening to someone, or specific things that fall into one of these protected class categories. And that determination needs to be made. Like it is, someone says, I think this guy was bullied, and that triggers this process. But that determination always has to be made, and has to be made under the existing bullying policy. So if something is reported, there is an investigation, as Delegate Miller pointed out, and some question is asked, was this actually on the basis of this person's protected class status? If it wasn't, it is not counted as an incident of bullying under law. And to your other question, I'm sorry for my slowness in responding, but information about supports that are in the school has to be part of the bullying policy. And additionally, in creating the bullying policy, the county board has to reach out to school administrators, members of the community, and others who might have those expertise to provide that information.
Thank you.
All right, so I'm willing to entertain a motion or more discussion. I feel like we're pretty settled. Does anyone make a motion on the amendment? Where the amendment was simply that we would lift the school system from the same sort of tort work that might occur if they go ahead and proceed with this.
I'm favorable.
Okay, I've got both of those. Is there any more discussion on that amendment? All right, then, all in favor of the amendment, please raise your hand so I can see them. Okay, there's only a handful of us left. People are on their way. We've gone on nice and long on this. And then on the bill as amended, is there a motion?
I move favorable with amendments.
And I've got favorable with amendments. Any further discussion? Delegate Miller, I don't see you there, so I'm going with 5 of us present, and all in favor of the bill as amended, raise your hands, please. And we've got 5. We got 1, 2, 3, 4, 5 to 0 on that. And that's fine. We've gone very long. The local bills can wait. I think that people need to get places. I know that Delegate Fair and I are supposed to be over in appropriations very soon. So we're going to go ahead and hold those. So we really only got through one bill, but we discussed the other one. I would very much like to take up the telehealth bill next time. So do your research, and we'll be meeting again soon. Thank you all very much.